And let's go on to the next panel. So again, I'll be doing the 1 minute left. So there's 1 minute left when I say 1 minute, and then we'll continue moving through. So we'll start with the School of Social Work.
Great, thank you so much. Hello, everybody, and good afternoon. My name is Mary Dallas Allen. I am the Master of Social Work Program Coordinator at UAA, and I'm so happy to talk with you today about social work programs. So I will share my screen. Okay, so on this first slide, I'm sharing the contact information for our BSW Program Coordinator, Dr. Kathy Traver. And her email address is provided there and phone number, as well as my email address and phone number. So I'll be telling you about both our Bachelor of Social Work program and our Masters of Social Work program. The Bachelor of Social Work program at UAA prepares students for professional social work practice. So social workers work with individuals, families, groups, organizations, and communities, and works with people across the lifespan, from prenatal through end of life. And social workers, although probably most well known for their work in the field of child welfare, social workers actually work across service delivery systems. So they work in many different areas with people. The mission of the Bachelor of Social Work program is to prepare generalist social workers who enhance human well-being, engage in decolonizing and anti-oppressive practice, promote social, economic, and environmental justice for all Alaskans. So students in the BSW program learn to collaborate with individuals, families, groups, organizations, and communities to advocate for social justice and equity and promote optimal functioning and well-being. So you can see that in addition to helping people, social workers are working to advance social justice to make the world a better place. It is important to know that the Bachelor of Social Work program and the Master of Social Work program are accredited by the Council on Social Work Education. And both programs have been continuously accredited since the BSW since 1978. The MSW program hasn't been around for quite as long as that. So in the BSW program, students engage in a variety of learning experiences, including a field practicum placement where they're working in a social service delivery setting. And that is really a essential component of the BSW program. So students complete a total of 120 credits, and 42 of those credits must be upper division. What is really important to know about the BSW program is that for students who are interested, students who graduate with a 3.0 cumulative GPA and a 3.5 GPA in their MSW courses may be eligible for the advanced portion of the MSW program. So they are waived 1 full year of the MSW program and can complete the MSW program in 1 year total time. So again, the Master of Social Work program at UAA is accredited by the Council on Social Work Education, and the mission of the program is to prepare advanced generalist social workers to address health and social issues across Alaska. We have a multicultural focus and really prepare students to practice within their communities. So we are a distance delivered MSW program. And students who participate in the MSW program are prepared for the licensed clinical social worker license if they choose to pursue that. So per our mission, the MSW program is statewide. It is a distance delivered program, so students from communities across Alaska join-in classes together. Students do meet online in class in Zoom web conference for an hour and 45 minutes every week in a scheduled course time, and complete about an hour of additional coursework in Blackboard. MSW students also complete 2 field practicum placements in a social work service delivery setting for a total of 960 field hours. Students can complete the program part-time in 4 years or full-time in 2 years. And as I mentioned, students with a BSW degree can apply for advanced standing and complete the MSW as quickly as 1 year. And applications for the MSW are due on January 15th of every year. And good news, GRE is not required. Okay, so that's all I wanted to share with you in my quick 5 minutes. If you do have any questions, please contact me or Dr. Traver.
Thank you so much, Mary Dallas. We are now moving on to the Justice Center.
I just need Mary Dallas to stop screen share.
That would be helpful. Sorry about that.
No problem. Okay, good afternoon, everybody. Really thrilled to be here. Hope you're having a great Saturday. My name is Brad Merstel. I'm the director of the UAA Justice Center. I just have a couple slides to present to you guys on Justice Center programs and career paths. So in the Justice Center, we have 2 comprehensive undergraduate programs, one in justice, which is what you might think of as a traditional criminology or criminal justice program, and legal studies. And within the justice program, what we offer is an interdisciplinary study of criminal offending, criminal victimization, and society's responses to crime and criminal victimization through the adult criminal and juvenile justice systems. The program prepares students for careers in a variety of justice fields, as well as graduate studies in criminology and crime analysis. And so we offer a Bachelor of Arts in Justice, as well as a minor. In legal studies, this is our newest program, and we offer a Bachelor of Arts, an Associate of Applied Science and Paralegal Studies, as well as a Post-Baccalaureate Certificate in Paralegal Studies, and a minor in there as well. And legal studies students get a comprehensive education in American law, legal process, and policy. And students leave very well prepared to enter the legal workforce and pursue advanced study at law school. So in the Justice Center, we probably offer the programs and careers that are the least obviously related to health, but only if you think of health in a fairly narrow fashion. We do not offer clinical health programs like many of those you've already heard about, but if we broaden our perspective from clinical health to begin thinking about community and behavioral health, the connections to our programs become much more obvious, particularly with respect to criminology and victimology, and thinking in a broader perspective of the social determinants of health and their consequences, and public policy, particularly as related to public safety and public and community health. So justice careers really reside at what you might think of as the nexus of public safety and community and behavioral health. And when we think about a lot of the choices we make in our everyday lives, where we go to school, where we work, where we live, what we do, and what sort of activities we engage in on a day-to-day basis, and make our lives healthy and well, public safety has a lot to do with that. And in addition, when we think about the causes and consequences of crime and criminal victimization, then the health implications become much more obvious. So our graduates work in a variety of justice fields and occupations in Alaska and well beyond. And some of those are fairly obvious and some not so much. So as examples of what you might consider obvious justice professions would be policing and federal law enforcement, for example. Many of our students go on to work at state and local police agencies here in Alaska, as well as in the lower 48. And many of our students pursue careers in federal law enforcement. We offer internships, for example, with the Bureau of Alcohol, Tobacco, and Firearms. Other students pursue careers in the FBI and other federal agencies. Beyond that, though, many of our students also pursue careers in victim services and advocacy, juvenile probation and mentorship programs, adult corrections and community reentry professions, as well as a wide variety of legal careers. In nearly all of these justice professional fields, directly and regularly work with health professionals across the spectrum, everything from paramedics to nurses to doctors and so forth. And in addition, it's important to note that you too can seek a career to be a crime scientist or criminologist like me. I'm a criminologist. You can become an attorney. And so both of our programs prepare students very well for advanced study at both the master's and doctoral levels. And with that, I will stop share and hand it back to Elida.
All right, thank you. Now we will move on to the Department of Human Services.
Good afternoon, everyone. My name is Seta Kabranyan Melkonian, and I'm Assistant Professor and the Practicum Coordinator at the Human Services Department at UAA. If you are interested in helping people and making a change in our society, human services might be a profession that you might be interested in. Human Services offers 2 degrees, the Associate of Applied Sciences and Bachelor's in Human Services. For the associate degree, we have 2 practicum that takes place in the community agency, and there's another practicum for bachelor's degree and a capstone project at the end. Both of these are implemented in community agencies. During practicum, students gain exposure to a variety of clients, and they develop ability to work well under pressure and manage stress. The department also offers certificate programs, occupational endorsement certificates in children's behavioral health and conflict resolution. Forthcoming will be 2 additional OECs in diversity and social justice and substance use treatment and recovery. What would you expect to do when you get an education in human services? Human service professionals work in a broad range of agencies. In child welfare, you would be ensuring the safety and well-being of children through intervention and programming. A lot of our students work with developmental disabilities to adjust to and lead an independent life, help them, and become advocates. We have students who work with older population, healthy or ill, and their families in case management and as case managers and counselors. Healthcare, facilitating the emotional treatment of patients and their families to deal with difficult situations, including hospice, prevention, and doing some case management. Some of our students choose to work with substance use disorder clients, being involved in providing treatment and intervention. As well as working with criminal justice and corrections, helping with reentry and rehabilitation, or assisting victims, counseling, and doing therapy. Many of our students who implement their practicum in agencies in their communities, not only in Anchorage, but currently we have students who do their practicum elsewhere. A lot of time, more often than not, they get hired at the end of the practicum. And they get the chance to get introduced to the agencies that they are implementing their practicum at. And we know that there is a very high need of human service professionals, and it is one of the fastest growing careers in the United States today, and as well as in Alaska. I would be very happy to answer any questions you may have. And our BHS coordinator is Dr. Yvonne Chase. You see her contact on the slide. And our AAS coordinator is Professor Lynn Paterna, and you can contact any of them to get more details about the program. We will be very happy to have you. Thank you.
Excellent, thank you. And then finally, we will go over to the Division of Population Health Sciences.
Thank you. Let me just share my screen here. Okay. For those of you that don't know me, my name is Kristen Bogue. I'm an assistant professor in the division, as well as the coordinator for the undergraduate program. I'm only sharing one slide today, hoping that you will follow up with me, and knowing that I love to meet with folks even before you apply to the university to answer any questions and help you to learn more about the program. I do know that we only have 5 minutes, so I'm going to be short and to the point today, but just know that I'm really excited to see this many folks joining us this afternoon. So one of the things I just wanted to say quickly is the Division of Population Health Sciences is newer, but not necessarily the programs. And the division focuses on preparing professionals at a variety of different levels. We have our undergraduate program as well as our graduate program and our research center, which focuses on identifying and addressing health issues of Alaska as well as other circumpolar communities. Our undergraduate program really is a multidisciplinary program and sets you up for a successful career in health education, health promotion, public and community health, disease prevention, rehabilitation, and even healthcare delivery, which I'll talk a little bit more about. But I really wanted to spend today helping you visualize what could you do as a graduate with the health sciences program? What does that really look like in action? And I thought I'd bring us to what we've all kind of been living through in one way or another, which is the COVID-19 pandemic, because a lot of our students, alumni, and faculty have been involved in a lot of different ways and serving on a variety of different COVID-19 mitigation teams, not only just here in our state, but in a variety of locations across the globe. So some of the work that folks have been involved with, just to give you an idea, has been helping out with epidemiological modeling. And for those of you that are like, what is that? What is that? Think about all the graphs you've been seeing all over the news. Think about the charts that they are talking about. Where are we at with our cases? And what does this mean for our hospitals and going back to schools and opening up businesses? So students have been involved with that work and providing data and forecasting for governmental agencies as well as community leaders so that they can help make decisions, really evidence-informed decisions to keep our Alaskan communities healthy, or the communities where they're residing in. Our graduates have also played a really important role in ensuring accurate health communication is available to all Alaskans. This has included assisting communities in getting information about the pandemic in multiple languages, in plain language, meaning, not in all of our clinical jargon, also in multiple mediums. So thinking about how can you use social media to educate and inform folks, making sure that folks have print materials, especially in communities that maybe don't often utilize social media or don't have access to it. And then, of course, working with trusted individuals in the local community so that they can be providing the information as well and have that information to provide local updates. The more recent work that's been going on that have been involving both current students as well as graduate has been a lot of work focused on reducing the spread of misinformation and improving health literacy. So thinking about, we've had students actually that have been reviewing social media posts, from the Anchorage Health Department, from the state, from a variety of communities that are really trying to get good information out there about COVID mitigation efforts, vaccination programs, things of that. But as we know, folks will get in there with lots of comments, and so they spread misinformation. So our students have been really working on engaging and difficult dialogues to break down that misinformation and provide evidence-based research and science that goes along with everything that we've been learning about COVID along the way. In addition, our students and graduates have been involved with contact tracing, including getting involved with supporting growing the workforce or being a part of that direct workforce themselves. We've had students that have been involved with the vaccination clinics. In fact, I was very fortunate that when I went in for my vaccination, I saw multiple students in there working, while they're still in their undergraduate program, which was fantastic. We've also seen folks that have been involved with providing training and consultation to local businesses, to the fishing industry, to community organizations about how can they still continue to provide their services in a safe manner. So those are just some examples of the ways that our health science graduates and current students have been out and active in the community. But what does it really mean for you when you consider the health sciences degree, especially when you're trying to think about your academic path? So one thing to note is our programs are focused on population health. And this means if you're interested in the health of communities, if you wish to promote equity, health, and well-being, then our program is exactly where you should be. Some of you might also be considering going on into clinical graduate programs after your undergraduate. So maybe you're considering, going to medical school, physician assistant, or the rehabilitative sciences. And if you are thinking about that, this is a great pipeline program for that as well. So we have a couple different paths that you can do in our undergraduate program. The other thing I wanted to share, though, is that our students actually have a great amount of opportunity to engage in the community as well as get involved with undergraduate research, which is fantastic, especially because it's one thing to be learning everything in the classroom, but it's another opportunity to get out there and apply it before you actually are out in your career. It's a great way to learn from your mistakes early on before you get in there. If you are interested in another program, but are still thinking about what does public health really mean? How can I do my work through a public health lens? We do also offer a public health minor. And for those of you that might already be out working in the field, maybe you already have your undergraduate degree, we also offer our Masters of Public Health, specifically focused on public health practice. And it's really focused on the needs of Alaska as well as the circumpolar health north, which I think is really critical and such a wonderful need that we can meet up here in Alaska. But to wrap up, our programs are a great choice for anyone that really wants to be involved with promoting health for all individuals and really seeking to remove systemic and structural barriers that has really resulted in a variety of health inequities. And for folks that want to seek an opportunity to work in a wide variety of settings. So our students work in healthcare, governmental settings, academia, including university settings, businesses, community agencies, and including school health. So if those of you that are interested in getting involved with schools or K through 12 systems, we can talk and learn more about that as well. So that is our health sciences program in a nutshell. Again, my contact information is up on your screen. I also want to encourage you to find us on Facebook. We do have a group. So you just have to ask to be admitted to the group. And then of course, our website has a lot of more information for you.
All right. Thank you so much, everyone.